All right, my friends, let's begin. We are diving into this reproductive system. Shh. There is a very nice little piece. Again, I didn't ask you all to read textbook-wise here. This is chapter 19, page 505. There's a very nice piece at the beginning here talking about egg harvesting, an egg donor. You realize that you can get paid some pretty significant change as a woman to donate your eggs. Guys, I'm afraid you have no. Yeah, it is for almost 5 figures that you will get paid. Oh, it's a lot of money. Well, read. You have to be above 18. But stay with me. Yeah, I say 4 figures and you guys jump like you've never had money. Stay with me. Sperm donor is a little less. Not nearly as much. Yes. Sorry. Here's why. You know, see if it's going to sound on YouTube for me just to keep saying shh. Okay? It's because there's a whole process. The textbook describes it very nicely here on page 505. Don't get caught in that. But there's a series of hormones that you have to inject yourself with to basically sync your ovulation cycle with the mother's ovulation cycle. And then it's to allow your ovaries to produce not just one, because your monthly period is a 1 egg release. Okay? Sometimes twins, unexpected twins, are 2 eggs that are released simultaneously. That would be fraternal twins, right? They're not identical. The egg didn't split. You had 2 eggs that were released in 1 month. That happens. But they want you to actually get 5 or 6 or 8 or 10 eggs to all come ripe all at the same time. It's a big process to do this. And then they harvest those eggs, and they store some of them, and the others they implant. This is what they call in vitro fertilization. Not 9 months, but yeah, it's a period of time. Absolutely. Because the hormones are basically stopping your body from having a period. We'll talk about what a period is, specifically what it is. But there are some dangers involved. The textbook talks about some of these things, some of the side effects that could happen. At the worst, you could become unable to have more children because of scarring on the ovary from this multiple egg release. So it's not without risks, but there is some change involved, you know? So, and then there's also the ethical question. That's how it ends at the end of this little piece, that now if I have donated my eggs, there is someone who is half me out there, right? And yet I have nothing to do with their life. That's usually what you sign when you agree to let your eggs be harvested, you know? So how do you deal with that, you know? Yes? I mean, I don't see any moral difficulty with that. I'm not necessarily just doing it, I would hope, to make money. I would be doing it to help this couple who, can't have kids. That's why you would go through that process. In vitro fertilization is expensive. We're talking about 6 figures expensive. It's not cheap. But to have a kid to spend money on. Hopefully there's some more redeeming benefits than just that. But yes. All right, so I figured I'd put that up there because it's really worth reading, that little first piece of chapter 19. Moving into the next piece, you all have your study guides, I hope. The study guides that look like this. Who don't? I know that you don't. I have 2 more copies. 2 more. Anyone else not get this yesterday? 1 more? I'll take it. Sold. All right. So, how I have found that this works the best is to go right to the anatomy and then talk about function as we talk about the anatomy. Are you with me? That seems to be the easiest. And truthfully, because we are much less complicated, we will spend our time with the male first. That was a bit of a joke, but no one even laughed. That's good. Oh, you're just agreeing with the premise. Yes. We are less complicated. Okay, you're good, Mr. S. All right, so significant anatomy as far as reproductive system for the males. What is the piece of DNA or the piece of you that a male contributes to a baby? The sperm. Okay, this would be the primary sexual cell for a male is the sperm cell, right? Containing all of my DNA as a male that will then combine with the female's egg, right? But only half the chromosomes, right? We'll talk a little bit about that because they're going to combine together to make that whole person, right? So that sperm is created where?
In the body.
In the body. Good. More specific. In where? I want you to say the words, friends. You should get comfortable with them. Yeah, they are created in the testes. Okay, that is, the testicles are the site of sperm production. They are outside of the body. You're comfortable that, what would be the woman's analogy to the testes? The ovaries, right? Are you comfortable that these descend from the exact same material? When you are a baby in the womb, at a certain stage, you are undistinguishable, male or female. Truthfully.
Isn't that why males have nipples?
I'm not sure anybody, I have truthfully read a number of things trying to answer that exact question. And I don't know. There really is not, you know, they don't serve any significant purpose that we've been able to decide. It would look kind of strange if we didn't have them, though. So, okay? Come back to me, though. I'll show you. I'm getting ahead of myself, but I'll show you this slide. This is taken from the Netter. This is like the Bible of anatomy and physiology slides, pictures. They're showing you this right here, up at the top. This is undifferentiated. In other words, this is where you are in the womb. I don't know how long. I'm going to guess it's going to be somewhere on the order of, I don't know, 5 weeks maybe, 6 weeks after, maybe 6 to 8 weeks after conception. You look at the genitals and they look the same. They're undifferentiated, right? And then you start to see the split, where the male, it starts elongating. This tube in the middle closes. This is not in your textbook. This is just like I said, it comes from Netter. It's this big, thick Bible, truthfully, of anatomy and physiology. And this is one of the slides, one of the pictures is there. So it closes, and you see that then, where the skin of the scrotum, the purple areas, right, that becomes the labia on the female. The testicles, where they would have descended out into that scrotum, for the female then go up into the body as the ovaries. It's the same tissue. It sounds crazy, but it is. It's the same stuff. It's kind of neat, huh? I thought that was very cool. All right, so back to our friend the male. The testes are here. That is where that sperm is being made, right? The question is, how does it get out, right? So you have this thing, this little coil of tubes on top that they call the epididymis. It's a fun word to say, epididymis. That's that little kind of coil on the top of the scrotum there, on the top of the testes, excuse me. And then that tube runs down, runs back up, and eventually becomes what we call the ductus deferens, or the vas deferens. Have you ever heard of a vasectomy?
Yes.
Vas, talking about that tube. Ectomy means to cut. A vasectomy means I'm going to come and I'm going to, truthfully, this is exactly what they do. Make a slight opening in the scrotum. They pull out that tube a little bit. They cut that tube. Not even cut, excuse me. Now they just clamp it. They put this metal clamp over that tube, put it back in, 2 little stitches, you're good. Of course, you have to do the other side as well. Why would they do that? What would this prevent? It prevent babies. How would it prevent babies? Yeah, the sperm is made here. It needs to get through this whole tube to get out in ejaculation. You're basically just clipping it in there. Oh no. They didn't just leave it cutted. They didn't just leave it cut. They would kind of sew the 2 ends.
Doesn't it just kind of build up then?
Sure. We're going for 3 times here on the shh. Stay with me. Christy asked a great question. Well, then doesn't the sperm then just build up? It does. But the same thing happens throughout the normal course of our lives. Sperm builds up, it gets reabsorbed back into the body. It's without any significant difficulties. It doesn't cause any problems for it to do this. Because, again, sperm is continually being produced in our bodies. And unless it is being released at a very significant rate, you're not going to get rid of it all. It's going to continue to just be reabsorbed. So there's really no significant difficulties. You sometimes get a little bit of achiness or pain that's associated with that, but nothing of significance. The alternative is to then do it on the female end. They can take the tubes. I'm way ahead of myself here today, but that's okay. We're just talking. Well, this is actually a better picture. They can take. This is looking at the ovaries, and this is in the middle is the uterus, and down in the vagina. They can take and they can clamp these tubes. Having your tubes tied, have you heard this term before? That's an old way of saying that's a way that they could prevent the egg from actually getting to the uterus. So, I am unaware of the surgical techniques, but I would imagine not. Right, exactly. Okay? But so these are methods of birth control. We'll talk a whole bunch more about birth control. It's one of the sections on your study guides that we'll spend some time with this lesson. Okay, back to the beginning again. Sperm produced in the testes through the epididymis down the ductus deferens, the tube, you follow it along, and you hit this organ right here. Can you see this kind of red guy here? Right there? That's called the prostate. You've heard of a prostate exam? This is an examination that men should have after the age of 40, because this is a very common place for cancers in men. One of the more dangerous places, to be honest, for cancers in men. How do they do that? Somebody was asking. Well, it's a rectal exam. Right. Check your prostate. Right. Glove hand up inside the anus into the rectum, and you can feel that. They're just like ladies who go to the gynecologist. They do internal exams, right? That's just how it works. You have to be able to see and feel these things. Okay? It's life. I'm sorry to say. It is life. Good. What's the role of the prostate? Does anybody know? I'm sure you could. It's in your textbook. What is the function of this prostate? Because you see where it is, right? Can you follow this line? Sperm produced here, coming down around this ductus deferens into the prostate. It has a very alkaline solution that it produces. Absolutely.
Neutralizes the fluid containing sperm cells.
It neutralizes what?
The fluid containing sperm cells, which is acidic from accumulation of metabolic waste that stored sperm cells produce.
So, the sperm inside the testes, like I said, they don't get out every day, right? They're accumulating. That makes them a little more acidic on our pH scale, right? So this fluid that comes from the prostate, this prostate fluid, helps to neutralize that. There's another area that this sperm comes in contact that is also fairly acidic. Do you know what that is? It's the vagina. It's purposefully acidic. Why? Well, this is an entrance into the body, right? We don't want bad things to get in there. So it's purposefully this more acidic area. Like its pH is lower than what you would call neutral. So therefore, when this prostate fluid, this semen in general, gets in contact with that vagina, if there wasn't some alkalineness to it, some higher pH, it would kill the sperm. Does that make sense? So it wants to neutralize that pH so that the sperm can actually live in this, what's truthfully a very harsh environment. The vagina, on a microscopic level, microbiologically, is a harsh environment. It's supposed to be.
It's like I'm watching National Geographic.
Okay, good. I told you there's going to be giggles. It's fine. It's life. It's life. Okay, so it's producing this prostate fluid, right? There's another piece that's right there next to that prostate. This guy right here, the seminal vesicle. What does that word sound like? Semen, right? Yes, it's also producing this fluid. So you've got the sperm, you've got the prostate fluid, you have the seminal fluid. All of these things mixed together is what we call semen. Does this make sense? So we always think of it being just sperm, but no, there's a number of other pieces to it. To help balance the pH, there's another little gland here called the bulbourethral gland. That bulbourethral gland is about lubrication. So before ejaculation, before the sperm and the semen come out, this gland is producing this it really is truthfully a mucousy type fluid that is a lubricant, that will lubricate the penis, it will lubricate the inside of the vagina. The vagina is the same thing. It has a bulbourethral gland as well that produces this lubrication to allow for sexual activity. Some people, that doesn't work that well. So they're very dry. So that's why there are lubricants that help this process, because otherwise it's not a very fun thing. It's not. Trust me. Sandpaper. Good. Good. It's good. I thought we were going to go there. I promised. Yeah, it'll go. All right, let's take a look. Can you see what all of that dumps into? So again, we have the sperm being made in the testes, through the epididymis, up the ductus or the vas deferens, around into the prostate, going past the prostate, meeting up with the seminal vesicle. All of that dumps into this tube right here, which you know as the urethra. So this is the tube that semen is eventually going to come out of. It's the same tube that what else comes out of? The urine from the bladder, right? That's what this guy is right here. That's the bladder. So on males, these two tubes are the same, right? Females, it's not the case. There are two different areas that these things come out of. But on guys, it's the same. Questions so far?
Actually, I have a question.
Please.
If you have to pee,
Yes.
does your bladder stop plug up the little tube that's right there?
So in other words, you're asking, could urine come up that tube back?
Does the whole bladder? What if you have to pee really fast?
Okay.
Would it ever stop that?
Would ever? Oh, you mean like prevent the movement of that fluid? It would not expand so much that it would physically block it. No. You can't empty it both ways at the same time. In other words, if there is enough sexual arousal that there's an ejaculation that's imminent, you can't pee. Like there are muscles that control both of these sphincters that won't let the urine come out. Does that make sense? So, I mean, truthfully, oftentimes there's even like a waiting period. Like you can't just get up and go to the bathroom right after that. It takes some time to allow the urine to do that. Because you're right, it's two things trying to use the same exit, and you can only have one going at once. Does that make sense? It's a good question. It's a very good question. Other questions? You guys with me? Good. Let's talk a little bit about the structure of the penis itself. So, two main types of tissue. Two main types of tissue in the penis. The first one they call the corpus spongiosum. That's basically all of this portion right here. Corpus spongiosum, what does that sound like?
Corpus callosum.
Sponge is very similar to that, yes, absolutely, right? Corpus means body, yes, okay? So it's the body that's spongy, right? And then you have the corpus cavernosum. Cavernosum sounds like what? Cavern, cave, absolutely. What you find is, stay with me, friends, this portion of that tissue is basically full of these little holes, these little empty areas, open areas, so that when arousal occurs, blood flow comes in, and there's a little muscle that basically squeezes at the bottom that won't let the blood flow back out. The more blood that flows in, the more the spaces in that corpus cavernosum get filled up, and the penis gets larger. That's what an erection is. Just simply blood flow into that area. Perhaps you didn't know that. And it's because of that. The corpus spongiosum is spongy enough that it'll stretch, because there is a significant change in length that occurs. Well, not significant for everybody, but for most folks. Sorry, I had to throw that in there. Had to throw that in there. Okay? But there is a change. You need this elasticity to that tissue that will allow it to stretch and move. Once the arousal finishes, then that muscle relaxes and the blood flows back out. Penis returns to normal size. Yes?
Is the spongy part, is that a muscle or is the other part the muscle?
It's really none of it's muscle. It's not contractile. There are muscles that are. There are muscles that are all around it, like in the pelvic floor region, but not in the penis itself. No. Yes.
If a boy is circumcised,
Yes.
two things at the bottom,
Right.
that what's being removed?
Right, so what a circumcision is, you can see on the glands of the penis, the head of the penis, there is this thing that's called the prepuce. The foreskin is another name for it. That is a covering that covers the head of the penis, which is how you are born. But a circumcision is to basically cut that layer of skin off of that top head to expose the head of the penis. Why? That is a significant piece, is that it was a sign that God asked. Another piece is there are some health benefits to it. There's a little more chance of infection because, again, you basically then have a covered area versus an uncovered area. So it's easier for there to be bacteria or things that can get into those areas and cause problems. The American College of Urology, so the doctors who are urologists who deal with male sex anatomy, it's kind of 50-50. They don't say you should, they don't say you shouldn't. It kind of goes in waves. Truthfully, as a male, if your dad was circumcised, you probably are as well. If your dad wasn't, you probably aren't as well. It mostly becomes just a familial thing. Yeah.
So why did God say not to?
He doesn't. He says it as a sign that this is I am telling you to do this so that you are marked as my people. And this is a fairly significant, again, because Abraham did this when he was in his 60s. It wasn't like he was a baby. And he circumcised every other man in the camp. Right? I'm sorry? I don't know if he was the one who personally did it, but I wouldn't be surprised. Yeah. So, I mean, this is a big commitment, right? I'm going to cut off part of myself on a very sensitive area as a sign of my faith. I think it's pretty cool, to be honest with you. I think it's pretty cool that you would do that. I don't know population numbers. I think the last time I remember looking, I want to say it was like, I want to say maybe 80-20 in the United States, circumcised versus uncircumcised. 80% are, 20% aren't. I'm not positive on that number, though. I think it's a most are versus most aren't. But I don't know. I truthfully don't know.
Wait, so what, is it better if you're not, or it's better if you are?
There's really no evidence showing one way better than the other. Okay? Most of the time in our culture, it's done at a very, very young age. You know, the day after a baby is born, a male baby is born, that's when my son was circumcised, was then. Because there's no memory, right? It's not like I'm going to say to my 13-year-old, hey, come on, let's go get circumcised. Yeah, that may not work as well, right? And for them, it's a fairly routine procedure. They're healed in a couple of days, for the most part. Yeah. Sorry? Well, you're not affecting, and again, I hate these side pictures because it's very hard to see. But you're not cutting the actual corpus spongiosum or the corpus cavernosum. You're just cutting this layer of skin that's on the top. So, is it sore? I'm sure it is. They cry. But it's not life-altering by any means. We finish at what time today? I don't know. I got to look. You think it is? I'm asking. That's why I'm looking. 45. Good. Shh. Send your comments and questions this way. I want to What's so funny is that no one is sleeping. No one is not paying attention, which I enjoy. It's fun. Shh. Questions, comments? Coming this direction. There's lots of conversations happening. I was just curious if you wanted to share them with us. Please. Shh. You're going to be on your class trip. Joe and Lisa and I are going to hang out. Yes. Let's go to the mall.
We can distinguish, between the people.
Yeah, we will find some things to do. Don't worry. Don't worry. But no, it's nothing you guys need to make up. No. Maybe we'll just go to Starbucks. I don't know.
Oh, no, that has been happening so much without me.
Question.
No.
Like transsexuals.
Okay.
For a woman who wanted to become a man. How would that
Now hold on. You're talking about a gender change? Okay, because that's different. No. So let me go back. Hold on. So if you go back to this slide, you're comfortable with this fact that we all start out as the same, right? So can there be problems with this differentiation? Absolutely. Okay? Where some folks would have genitals that are a little bit of both. Okay? Because can you see that, and again, we haven't talked about the anatomy yet, but I'm sure you know most of these terms, that the clitoris is basically a penis. Okay? It's the medical term, my friends. Okay? So if this were to become larger, right? If for whatever reason, hormonally or whatever. There's 1,000 reasons why these things can happen, that you can end up with a little bit of both. You can end up with having male characteristics in a lot of ways and having female genitalia. It can go the opposite direction. So, this is a very large thing right now. That there are...
Is that a defect? Like a birth defect that somebody could have fixed at birth?
sometimes yes. Sometimes yes.
Not today.
Right, there are a lot of different terms that mean a lot of different things. Yeah, you're correct. Yeah. But... Sorry? Right, so... Right. These are tough questions. What determines gender? For years, what was said was it's basically what genitalia you have. But what if that is not differentiated well enough for you to tell? You know? Some parents even go as far as to say, I'm not going to call you either a boy or a girl. I'm going to let you figure this out. You know? So... it opens up a whole other world of how you determine gender, right? Please, again, comments, conversations, bring them here. All right, if we want to converse, let's talk about it together. Okay. But I think it's something we need to be sensitive about. You know, there's only two bathrooms, right? There's a guys and there's a girls. Well, if you have pieces of both, which one do you go into? You know, how do you self-assess? You know, so and these are serious issues that as a society we're dealing with, because 20 years ago it was all happening, but no one was talking about it. Whereas now things are a little more out in the open. You have a comment or a question, Joe?
Kind of both, I guess. When people are gay, will maybe some of that be from, like, psychologically, they're like female, but physically like a man?
Is that even possible?
It absolutely could be. It's very difficult. They cannot say what makes you, what determines your sexual orientation. This is a whole big conversation about is it something that you are born with? Is it something that you choose?
Because I've seen like little documentaries, like little kids who like, at a young age are already
Right.
like, grown up.
Right. Right. So, you know, what determines this? Is it your environment? Is it what you were born with? Is it both? I'm very much a proponent of both. But yeah, it presents some interesting questions. Yes. Sarah.
I was watching I think I was watching like Prime Mix show. I was watching one of those shows. Anyway, there was this lady and she said that she had two vaginas.
Okay. I would say anything like that is possible. Sure. Again, maybe for some reason the tube, because the vagina is basically a tube, had some kind of division in it. Could be. Yeah. It certainly could be. Not very common, I would think. But Christy, you got a comment or no?
Yeah, I was just, I don't know if you can answer, but like how,
My friends, stay with me. Stay with me.
how the differences between males and females, like in the brain, like guys have like larger brains, I think, and then there's chemical differences, but like
Right.
if you're a guy, but you feel like a girl or whatever, but you have everything that should be on a guy, then can they like somehow inject different chemicals into your brain and like change like your preferences and everything?
All right. So not necessarily preference oriented.
Not
But
preferences.
as far as you were talking about sex change operations or changing from one to the other, that is very much what they do. They can do some surgery to affect the anatomy, but then it's a lot of hormones as well.
But like not the hormonal stuff. Like I know they do that, but like how the girls have chemicals in their brains that makes them like more family oriented or something like
Okay.
that. Like stuff that actually affects the way you think, not just like sexual.
They are. That's hormones.
No, like when I
So, but they do that too.
Right.
Like not just like with sex stuff.
Yeah. Yeah. They do. They do. Yeah. That's the main thing. That there are some connections, like just neural pathways that they found have been different between the two. But yeah, it's good questions. But it does, again, what it does do, what I hope that this does to you, is just open your eyes to say that there are things that are different out there. And I think that we need to be very careful that we don't become so quickly judgmental. Okay? I'm not trying to make this into a religious discussion, but know that we are, as a people, as Christians, are not known as being very open-minded. We're very quick to say right or wrong. Ew, disgusting, that's different than what I think it should be. And I'm not saying that God doesn't have a plan for us. What I'm saying is we need to be very sensitive, because maybe this person did not choose to have that certain genitalia, or did not choose to have that certain orientation. There's a lot of people who would disagree with what I'm saying, but to me it only makes sense. Sexuality is such a powerful thing. Why would that not be something that could be changed? You know, that purposefully, corrupted is a bad word because it makes it sound like it's wrong, but I'm saying, why would that plan not be changed or tried to be altered by our enemy? Question? Sorry? How do you have both genitalia, you're saying? Well, truthfully, the only significant difference between the male genitalia and the female genitalia, you can see the male, it's closed, right? Where the urethra is, which runs right up this center, is the opening of the vagina, right? Here's the urethra for the female. So there's really not a significant difference. The glands and the shaft of the penis is basically what the clitoris is. So there's really not much difference. If this were to get a little bit larger, it would very much look like a penis. So if developmentally you don't go one way completely or the other way completely, you could very certainly have pieces of both. Does that make sense? Yeah. Good discussions, my friends. Adios.